Well, ticks, let's start out with prevention first. So that's the big thing. Prevention is proper clothing. I mentioned boots, mentioned long pants, and with the pants, the best way is to tuck them into your boots or put your socks over the outside if you're walking. There's a material called permethrin that you can spray your clothes with that will keep mosquitoes, ticks from biting. It's good for about 5 or 6 washes in the laundry, so you can spray your clothes, let them dry, and then go out and wear them. And the insects tend not to like that, so they'll stay away from them. Light colored clothing might be helpful in that you could see a tick crawl up on you. Checking daily if you're out in the woods to see if you have ticks, because ticks can crawl up. They usually crawl to hairy areas and will try to stay latch on there and start sucking blood. Those would be the main things with prevention. Obviously, DEET would, on the skin, any of the DEET would be products. And roughly, just for a rough estimate, every 5 of DEET will last about an hour. So that's just a general rule, not hard and fast, but just say, if you have a 40 DEET, that's going to last you 8 hours, so it's not going to last you all day. There are different types of ticks. They can be from very, very small that you hardly even see them to where they look like a speck on you, unless you could get a magnifying glass or pull out your glasses like I have to wear sometimes, all the way up to the size of an eraser. Dog ticks are pretty big. And actually, in the eastern United States, dog ticks are most likely to be the ones that carry the different diseases. Out west, it's more the wood ticks, and here it's going to be more the dog ticks. However, having said that, again, most tick bites don't cause any injury or any disease. Most ticks don't have diseases. How's that? But if you are bitten, then there are a variety of unusual illnesses that you can have. The most common we probably know about is Rocky Mountain spotted fever, which presents typically with a rash, headache, and high fever, 102, 103. Then there's others, tularemia, babiosis, ehrlichiosis. I can't even remember them all, and nor do I profess to be very intelligent in those. They all tend to have flu-like symptoms. So muscle aches, nausea, headache, with or without a fever. In the spring and summertime, especially if bitten by a tick, should be a red flag to say you need to go ahead and treat it. Now, if you have a tick, generally, unless it's been on there more than 36 hours, you won't, even if it had infection, it's unlikely for you to get any infection from that. But how do you know how long it's been on there? That's the hard part. The Lyme disease that everybody speaks of has different stages. The most common stage, or the first stage, is where they have what they call a bullseye lesion. So you have the bite, you're taking the tick off, and you get a red spot in the middle, a clearing area, and then a little red ring. So it's more of a bullseye. So that's a typical lesion that would need definite treatment. For if you came in and said, I had a tick bite and this is what it looks like, I'd say, you need some antibiotics. We'd treat that. It has other stages that can be, if it's not treated, that can progress and have a chronic stage actually. And it can affect the heart and the brain in its extreme forms. But again, very uncommon. First of all, you have a bite. Most of them don't carry disease. Then if you get it and get Lyme disease, then the chances of having a serious heart or lung problem is like winning one of the lotteries. Not quite that bad, but close. The best way to remove a tick would be to get some tweezers underneath it. What you don't want to do is you don't want to put a match on it. You don't want to blow out a match and then put it on there. Or you don't want to squeeze it, because then you squeeze all of its juices and stomach stuff back into you and make it worse. Same thing with a honeybee. Honeybees are the only kind that leave their stinger. Is that kids movie where once they sacrifice themselves, when they sting you, it's for good because they leave their tail there. But if you squeeze that stinger, you just push a bunch of venom in. So you have to get some tweezers under it and lift up gently. Same thing, putting salve on it or things like that, trying to suffocate it, not going to work. Just have to get some tweezers and lift up. They make commercial tweezers that do that kind of thing.
If you get a tick bite, how do you know if you need to come to the hospital?
Well, typically, let's just take Rocky Mountain spotted fever since it's probably the most common. Anywhere from 2 to 14 days, you would start having symptoms, and it would be, headache, high fever. So if you don't have any symptoms, then I'd say you're fine. But if you start having muscle aches and flu-like symptoms within a couple of weeks of having a bite, then I would say probably ought to go get checked. And we tend to be a little more aggressive. The most common antibiotic used for this is doxycycline, which is a tetracycline drug. It's $4 at most of your pharmacies, and for 2 week supply. And you're usually on it for 2 or 3 weeks, depending on what kind of disease or what kind of process we think you're having.
I'm allergic to that, so I better not get bitten by a tick.
Yeah, might have to think twice about you.
All right, I'm good. Are you good? Everybody?
Well, I have a question.
You got a question? Yeah.
If the dog ticks around here are the ones that carry the diseases, does that oftentimes transfer to humans? I mean, just because we call it a dog tick doesn't mean it automatically latches on the dogs all the time, right?
Correct. It can
Okay.
latch onto people.
Okay.
And also, when you handle ticks from the dogs, you need to wash your hands.
Yeah.
Because that feces and stuff on there, then it can get into an open sore in your hand.
Oh, yeah.
So you have to take some precautions. Yeah. If you're picking them off, I'd just wash your hands afterwards, or use gloves. But most of people just wash it. And again, most of them don't have the rickettsia in them, but you don't want to take a chance. Good question.
I have a question too. When my kids used to pick up lizards and things all the time, they were always cautioned by the doctor that they carry salmonella. Would snakes fall into that category too? So if you're bitten by a snake, even if you don't think you got any venom in it, would that be a concern?
That's a good question. I've never heard of salmonella associated with snakes.
Okay.
I'm not saying that things couldn't be, but it's not a common thing that you'd think with that. Just like with rabies, there's not your rodents like your squirrels and those kind of things don't carry it. The reason is that if they ever get bitten, they're going to get killed.
Okay. Yeah.